Okay, hello everyone, and welcome to today's webinar on how workplace nutrition and wellness impact employee culture. This webinar is brought to you by Culture Summit and Oh My Green. If you're not familiar with Oh My Green, they provide concierge-style kitchen management for companies of all sizes. They deliver, stock, and maintain healthy snacks for your office, as well as cater full meals. And they do this all using technology that you can use to track consumption and control within your budget. We're extremely excited to be partnering with Oh My Green this year at Culture Summit. Now, for a few housekeeping items, this webinar is recorded. At the end of the presentation, we will send you an email with a link to the recording. And if you have any questions during the webinar, we'd love to hear it. So please submit your questions in the Q&A panel of your screen, and we'll spend some time at the end of the webinar answering your questions. My name is Hung Pham. I'm the founder of Culture Summit, a conference that brings together culture champions from around the world to share insights and strategies on how to build and transform culture in the workplace. I'll be your moderator for today's session, and I'd like to introduce you now to today's presenters. First, we have Dorothy Fisher, Chief Marketing Officer at Oh My Green. Dorothy is an accomplished business and marketing executive with more than 20 years of experience in marketing strategy and execution, developing products from concept to launch, building brands like YouTube, PowerBar, Visa, and others. And joining Dorothy is Matt Canlin, Senior Vice President at Oh My Green. Matt brings more than 20 years of marketing experience to Oh My Green. He's worked for tech pioneers like Nuance, category creators like Twilio, and numerous other companies. Matt's now turning his attention to wellness and nutrition at Oh My Green, and as a member of Oh My Green's strategic team, he works on the organization's growth and market expansion plans. So I'd like to hand it over to Dorothy today to introduce today's topic.
Hi, everyone, and welcome to today's webinar. Productivity losses related to employee health problems cost companies $225.8 billion annually, according to the Center for Disease Control, or otherwise known as the CDC. In fact, indirect costs of poor health, including absenteeism, disability, or reduced work output, may be several times higher than direct medical costs. Employees are now only becoming more acutely aware of the connection between nutrition, health, and overall wellness and employee productivity. And the relationship between nutrition and employee output is demonstrated by these facts. Employees want on-site nutrition programs according to industry studies, and the result from those programs can be significant for people taking advantage of the programs and their employers. Yet less than half of companies make them available, or worse yet, they undermine individual efforts by supplying unhealthy, processed snack foods in the break room, donuts in the kitchen, and industrial food services in the corporate cafeteria. How can you avoid unnecessary employee absenteeism and productivity losses in your business? What can you do to improve the health of your workforce through nutrition programs? Well, that's what we'll discuss in today's webinar.
Thanks, Dorothy. Matt, can you talk us through how important is nutrition in the workplace? Maybe you can walk us through what a typical day looks like.
Yeah, absolutely. Thanks, Hung, and thanks, Dorothy. If you're like me, or like a typical office worker, I guess I put myself in that sort of typical office worker category. This is, kind of what my day looks like, right? So, if you wake up in the morning, well, I think you wake up in the morning. Everybody wakes up in the morning. You have a ton of things that you've got to get done. And you probably are probably the least important person at that point in the day. If you're lucky, you get a workout in. But typically, you're trying to get your partner out the door. You're trying to get your kids to school. You've got a ton that you're trying to get done at that particular point of day. And then you run out the door and you try and grab something. And, you try and grab something healthy, but that's not always possible for that morning meal. Maybe you stop at the local coffee shop, you grab, a piece of coffee cake or a donut or a bagel or some sort of wrap or something along those lines. And that's not always the healthiest thing to do. And then you get to the office and you breeze in, and you're trying to get ready for the day, and oftentimes there's food in the break room, and you grab something really on your way in the door or your way to that first meeting. You get to that first meeting, and maybe you're exiting that meeting, and once again, you're sort of presented with some sort of food in the break room. It could be, again, things like a donut or a bagel or some sort of candy or something along those lines, and you grab it because it's there. And then you move on to the midday meal, and if you're lucky enough to have something like a on-site cafeteria, you're sort of beholden to whatever the menu is at that cafeteria. And a lot of times the people who are running that cafeteria are not really health-minded. So you end up eating what is being served that day, and it could be, pizza, or it could be, something completely, unhealthy from the cafeteria, or maybe you're forced into a grab-and-go situation, which is never, really good. Then, in the afternoon, you're looking for something to pick me up in some sort of sugary snack is typically what people grab. Maybe they grab an energy drink or something along those lines that's full of sugar or caffeine or something to fight that sugar crash. Again, not the greatest thing in the world. And then you transition home and you grab, again, something for the road. Maybe you grab a sugary beverage for that long drive or something along those lines. Again, you're sort of a little bit beholden, or a lot beholden, quite frankly, to what's in that corporate kitchen. And then you're back home, and that's really, I think, where you have an opportunity to really take control of what it is that you're eating again. So you can have a healthy dinner, you can have a light dessert, something along those lines. But in a lot of cases, really that could be your very first time of the entire day to take advantage of maybe the healthy eating that you're trying to bring into your life. And then, you look towards the end of the day where you're winding down and getting ready to do it all over again. One of the things that we've found, and I think these studies have been really written numerous times, and even in our own research, talking with our customers and working with organizations around the country, what we found is, well over half of your working hours are spent at work. And that's a huge statistic in and of itself. But one of the other things that's pretty amazing to me, and I didn't really realize it until we started doing our own primary research, was how many meals are consumed at work. It's probably, for most people, 70% plus of the meals. When you look at the breakfast, the snacks, the lunches, the afternoon snacks, the food for the road on the way home, it's 70% of the meals, maybe depending on what you're eating at that office. Really, I think something that could be 80 or 90%, frankly, of all the calories that you're taking in. So, I think this is huge for organizations as they really start to think about how they can impact employee health and wellness, really thinking about how important those meals are that are being served in the organization. There was a study written, I don't know if you guys saw this, but it was, written on CNN and, a bunch of other places around how many negative healthcare outcomes, in this particular case, it was cancer, that was directly related to, people's nutritional and eating habits. And it was a massive amount of negative outcomes attributed to that particular, that study attributed to the eating for the people that were surveyed. So nutrition clearly is one of those things that I think we have a huge opportunity to impact as organizations that are feeding their employees.
Thanks, Matt. Those are great data points, and I'm very familiar with the typical workday you just walked us through. I know for me, when I used to work in Silicon Valley, I would sacrifice a lot of my productivity for convenience. So this really hits home for me. But let's get into this a little bit more. So we know nutrition directly impacts health, and health directly impacts productivity, absenteeism, and what's also known in HR as presenteeism. So we know what absenteeism is, but can you share, or can you and Dorothy share a little bit more what presenteeism means?
Yeah, I'd be happy to explain that. And Hung, I didn't even know what presenteeism was until just this past year. I had always known what absenteeism is. You're sick, you stay at home. That's clear cut. But I just learned that presenteeism is really the problem when the workers are on the job, but because of illnesses or other medical conditions they have, they're not fully functioning. And what's really interesting is that research shows that this can cut individual productivity by 1/3 or more. And it's even more interesting that presenteeism appears to be much costlier problem than absenteeism. And unlike absenteeism, where someone's sick, they don't show up for work, it's clear when they're gone and when they're out. But with presenteeism, you can't tell when or how much that illness or that medical condition is hindering someone's performance. So it's really this underlying issue that is really hard to measure and is an even greater problem than absenteeism.
Okay. What about its impact of nutrition on health? Can we maybe chat a little bit about that?
Yeah, absolutely. So Dorothy and I were in Europe recently meeting with a handful of people that are part of the food industry in Europe and as well in the United States. And one of the things that we talked about was how important nutrition is relative to physical fitness, and how oftentimes, it's the data shows that the food is 3 times more impactful on somebody's health than whether or not they're physically active or physically fit. And it was interesting that the story that was told was really about how, the big food industry, the industrialized food production in the United States, how strong the lobby is at redirecting our attention away from the importance of food. And in fact, one of the things that the lobby is doing is really trying to redirect our attention away from, the quality of the product that's being put out and its impact on the negative impact of that food product on people's health generally in the United States, and trying to get us to pay much more attention to this physical fitness aspect. And nobody's doubting the fact that physical fitness is also important. But again, the data really shows that nutrition is far more important than the physical activity piece. And what it impacts, quite frankly, are things that frankly are really almost at epidemic proportion, right? So if you look at diabetes in the United States, absolutely dramatic in terms of the increase in diabetes. Obesity continues to be a problem, and then hypertension and heart disease are huge problems. These are all things that are directly impacted by the food that you put in your body. And again, one of those things that we as corporate citizens can impact based on the way that we feed our employees today.
Thanks, Matt. How does the health impact the major productivity drain of absenteeism and presenteeism? I know you talked a little bit about that previously, Dorothy, but can you dive a little bit deeper into it?
Yeah, and I think, conventionally, I've always thought of absenteeism as I have a cold or my child has the flu and I need to stay home. Like, to me, that's when you stay home because you're ill. And, before I became more educated in the nutrition space and how important good nutrition is, I really thought of it in those limited terms. And it wasn't until I started really researching and understanding how just poor nutrition can impact health and what happens when that health is impacted on your daily life. When it comes to absenteeism for a small employer, uh, it can range for 6 days for someone who has diabetes, and up to 31 days for someone who is suffering from obesity. And you think of the extra strain that person has on their body, perhaps the additional time out of the office to take care of their health. When you have someone who's suffering from other medical conditions, it really does impact absenteeism in multiple ways, and that ends up hitting the bottom line, and it can be quite costly, for a small employer, and you can only imagine for larger employers too how much that can escalate. And I think the next example really illustrates that too.
Thanks, Dorothy. So we know the impact when we talk about the number of days that employees miss. But one thing we hear a lot from in our community is, how do we take that and turn it into data points that we can use to get leadership buy-in when it comes to changing our nutrition programs at work? Are there anything that we can talk to in terms of dollar amounts, Matt?
Yeah, absolutely. And I think the great thing is that there's a growing number of surveys that we can turn to as professionals. And one of the great resources is the Center for Disease Control. And they've done a ton of research over the course of the last couple of years. And one of the big bodies of research now is around healthcare outcomes, the impact of those productivity losses on employers, quantifying that based on some industry averages, and they've come up with some dollar amount. So one of the recent studies that was just published, and we were very interested to read, was really kind of the subject of this webinar, which is the quantifying of these losses as a result of these health problems. And it's a huge cost. This almost $226 billion cost is massive. And when you look at it across the total base of employees in the United States, and there's about 130 million people employed in the United States, it's almost $1,700 per person. Now that number, that $1,700 number, could be significantly higher than what you're seeing as an employer today. So when the CDC did this research, they used a $29 per hour average wage, so roughly $60,000 per person in terms of annual salary. So if you look at this, and let's say you're in Silicon Valley as an example, and your cost or your employer salary is more than $60,000 a year, maybe it's double that, your cost here could be double that as well. So instead of being $1,700 a year, it could be $3,000 a year, $3,400 a year. Very, very significant in terms of your impact, the negative impact of absenteeism and presenteeism.
Thanks, Matt. So it sounds like the indirect costs are the biggest part of the puzzle, certainly. Dorothy, you had another interesting stat about direct medical costs. Can you talk more about that?
Yeah, I'd love to. We work with Felicia Stoller. She's one of our advisors, registered dietitian, exercise physiologist. She has a PhD in nutrition, and she wrote a book recently that I loved called Living Skinny and Fat Genes, A Healthy Way to Lose Weight and Feel Great. And she gives a lot of tips in her book. She also talks about nutrition and a healthy lifestyle and the indirect costs related to poor eating habits. And it adds up really quickly. So the economic cost of an unhealthy diet, and we've just discussed earlier that the diet has a much greater impact than any other factor. And when you add that up with physical inactivity, that totals almost $100 billion per year, or more than $700 per employee in direct medical costs. And it really adds up quickly. And I think the silver lining here is that these are all things that we can address, right? This unhealthy diet and physical inactivity, it doesn't have to be such a dire situation. That these are all things that are within our control. And the workplace is a great place to start and to start to decrease, those medical costs per employees by just a few changes. And the numbers really add up. And I think even the next example is that much makes it that much more clear of just how much you can save.
Yeah, I think one of the things, and thanks for that, Dorothy, that we tried to do as we were working with our customers is start to try and put this in a frame that you could use in order to bring those big numbers down into something that's much more direct and controllable and understandable for your business. So we created this very simple calculator, right? And that calculator just runs off of those numbers that you saw from the CDC and from Felicia Stoller and from others, right? So, you can plug in the number of employees that you have. You can look at those indirect costs, that $1,700 per year per employee if you've got, that $60,000 per year salary. Those healthcare costs, so again, that's $700 per employee cost. And then you can, simply multiply those numbers together and come up with something that you can look at as a human resource professional or a benefits professional in terms of the potential negative impact that you could be having on your business, both direct and indirect, for the workforce that you're managing. So, super simple, super straightforward, but also allows you to plug in the variables that are directly related to your business, so you can come up with a dollar number that you could share potentially with senior management to indicate what that negative outcome could be.
Thanks, Matt. I know tools like these are very popular with our community. Can you walk us through an example of how do we use this nutrition calculator?
Yeah, I can do that. I really love this calculator that we built because it makes it quick and easy to get a ballpark estimate of what this costs the company. And so here we've just filled in just an example, and keep in mind that the number that we're using here is based on a $29 per hour wage. So your costs can be different, and I should say your potential cost savings could actually be significantly higher if you have a higher wage. But in this example, we plug in that we have an employee population of 1,000 employees, and we also plug in here the potential cost of the lost productivity per employee of close to $1,700, which is what Matt walked us through earlier. And then the associated healthcare costs of $700 that we know happens with poor nutrition and physical inactivity. And then you look at both the direct and the indirect exposure, times that per employee, and you see that it adds up to a very significant number. And in this case, it's $2.385 million per year of what this could be costing your company. Now, again, I said this is for an example using $29 per hour, but it depends the industry that you're in. So, and the average salary per employee, the lost productivity number could be much, much higher. So if you're in the technology industry or in financial services where the salaries on average are $100,000 plus, the cost could look more like $4,000 per employee. So you can only imagine that increases it more than fourfold in this example of 1,000 employees. It really does add up when you start to do the math.
Thanks, Dorothy. This is very eye-opening, and I think it's a great tool we can share with our community. Anything else we should know about the tool, or just any comments in general for this example?
Not for this example, but I think the next tool that speaks to cost savings really walks us through the silver lining of how much you can save. I think that's going to walk through that.
Yeah, let me do that. I think, we talked about kind of that negative impact, and we'll just use the same numbers. And let's turn this thing on its head a little bit. Let's talk about the positive impact, right? So we'll take the negative number, that almost $2.4 million, and let's talk about, what if we can improve that by some rate? And it doesn't have to be huge, right? What if we do it by, 5, 10, 15%? Take that number, right? The 15% number, times that by the negative outcome, that $2.4 million, and that starts to add up to real money as well, right? So if you can impact that negative number by 10, 15%, you can bring $300,000-$400,000 back to the organization in better productivity, less absenteeism, less presenteeism, and you can take that productivity savings and that direct healthcare cost savings, and you can apply that potentially to the benefit package that you're creating for your employees. And that number, in this particular example, the $357,000, that number is something that you can use to sort of, again, justify some increased spending potentially in that benefit program. And if you agree with kind of the where we started the conversation, if it's about nutrition, healthy eating, things along those lines, all of which can be impactful from a positive standpoint here, you can use that, $357,000 partially to fund that program.
Thanks, Matt. A question I get a lot from our community when it comes to presenting new programs to their leadership teams is, how do we calculate the ROI of what this program is? Any thoughts, either from you or Dorothy, on how to benchmark or calculate the impact of these programs?
Yeah, I think we talk about the increase in productivity, and we give some examples here of the costs and the reverse of that, the potential savings when you invest in these types of programs. To have a hard ROI, it really depends on the company, the different measures that they take to help with employee wellness. There's definitely food programs that you can put in, physical activities programs that you put in. And I think the more that you support the employee and the workforce, the more of a savings you're going to get. And not only that, but when you support people in the workplace, it's a pleasure to go to work. At Oh My Green, I can speak that I feel so lucky to go to work, and and to have a catered meal that has been so well prepared. The food is nutritious, it's delicious. The snacks that we have that I enjoy in the morning or in the afternoon energize me versus give me a sugar crash. So, Oh My Green's really the gold standard as far as supporting employees with really top nutrition and delicious foods, and that helps with recruiting, retention. It helps with productivity in the workplace, and as I said, it really depends on the actual company, how large the company is, how much of a culture shift it is from where they are today to where they hope to be in the future. But there are some real results that you can see with just small changes in providing healthier foods. And I'm speaking now more anecdotally. These calculators give you an idea of what it looks like when you're looking at direct and indirect costs. And so that gives us a sense of ROI. But I can share anecdotally what I see day to day at the company of people being able to power through their workday, and not only just power through it, but really enjoy it. Enjoy being at work because it's now a place where your health, your wellness journey can actually be carried on throughout the day. Matt talked about your average day where you get up, you get to work, and then between the hours of 8 and 5 or 9 and 5, you're there and you're beholden to whatever food is provided for you. But if you actually go to a destination, if your office can be a destination for healthy living, it changes the work dynamics and productivity in a completely different way. Those are my thoughts. Matt, do you want to add anything else to that?
Well, I think the thing that I would add, and I completely agree with you in terms of what food can do in the workplace and what it's done in particular, at Oh My Green, for you and I think the rest of the employee population there. But I think that, when it comes to sort of measuring that impact and trying to benchmark the before and after state for organizations, one of the things that we're starting to look at, and it's still a little early days for us, but we're starting to look at, sort of that absentee rate kind of before, and then the absentee rate after. So let's say you've, got an employee population, you don't have a health and wellness package, you don't have a program that has healthy eating as part of what you're offering. Benchmark the company in terms of, absentee days, and then put that program in place and benchmark the organization after that, right? So have you decreased the number of absentee days across your employee population? That could be a very easy, calculation for most, human resource folks to do is really just look at, how many days before the program on average per employee, how many days on average after the program was put in place, 6 months after, a year after, that kind of thing. And I think you'll see a pretty significant improvement.
Thanks, Matt. Dorothy, I have a question for you. So let's say I'm ready to implement a healthy eating program as part of my company's wellness journey. How do I get started?
Yeah, I think if you want to move to the next slide, that's great. Yeah, engage with companies that truly are mission driven. I think Oh My Green is an example of that. That really live and breathe the mission of wellness. And it can start with a simple snack program. It doesn't have to be overhauling your whole meal program. You can just start with snacks because that tends also to be the time of day where people go for the junk. They go for things that will really not help them end their day strong. There are some wonderful snacks that we offer, or that other vendors offer, that are nutritious and they're energizing. So things like snacks like fruit and nut bars. So some popular ones that we carry are Kind bars, RX, the Lara bars. You can have yogurts, other dairy products that are really filling, string cheese, edamame for some soy protein. The next one's my favorite, a hard-boiled egg. So I tend to go off and on my keto diet, and hard-boiled eggs are the go-to snack for me when I'm on that diet. And or so for somebody on my team, it competes in physical challenges, and so for him, his muscle mass is really important, and that's his go-to as well. You can have low-fat cheeses and smoothies, and or even bulk items like bulk almonds or pecans. It's a great way. A small handful really fills you up and helps you finish strong. Seeds for those who have allergies to tree nuts are an alternative. So just, if you think of the slump that you have in the afternoon or that pick me up that you need in the morning to get going, just a snack program can really have a meaningful impact. And help help employees stay focused, avoid the sugar crashes, and I think you can get quite a bit with just starting on snacks. That's a great place to start.
Yeah, and I think I'll just add to that real quickly. This is not something that you necessarily need to engage some specialty vendor for. It's one of those. It's harder if you don't work with an organization that curates actively a list of healthy products and provides that as part of its DNA. But I mean, you can't do it, right? It takes time. It can be a lot of work for the in-house team to do things along these lines. But, things like, RX bars and Kind bars and Lara bars and, things along those lines, they certainly are available from suppliers of various types. I think what you have to do is really think about how do you really want this as part of a benefit program? And I think a lot of organizations are realizing that they've got to do that in order to be successful, in order to attract and retain top talent, and maintaining something like this once you launch it can be hard, and that's I think where the specialty suppliers come in. Whether it's Oh My Green or somebody else, we can make that a lot easier for the organization.
Yeah, and I think you touched on an interesting point, Matt, because, all of these foods, they're available through Instacart, or you can do a Costco run. So, if you really just want to see how this is going to do in your office, you could just test it out like that. I do think it takes a lot of time. And I know that when it comes to some of our clients, we've heard that, we've given them hours back in their day because that office manager's either getting it through Instacart or doing the Costco run herself, and she's loading it, and things are consumed at irregular paces, right? So maybe the Lara bars are gone one afternoon, and maybe the nuts take a little bit longer to get through, and so trying to understand that consumption rate in the office can be tricky, and that's why when you're ready to work with a vendor like Oh My Green, we really help you with the analytics. We help you stay within a budget, and because we buy things in bulk, we are able to work within a budget and provide the service of restocking regularly and giving the analytics so you can report back to the staff, to your executive team about how the program's doing, what people are eating, and it can make it just that much easier to manage a wellness program. And Matt mentioned earlier that with the cost savings that you have by focusing on nutrition, can actually fund a program like this and still have leftover money. I mean, it's quite interesting when you start to focus on those cost savings. Just redirecting them to a program like this, you still come out ahead, which is, I think, really great. And I think the next point yeah.
Sorry. So aside from snacks, Matt, can you share more about what or how to avoid certain foods in the workplace?
Yeah, I mean, I think the snack program is a great place to start, as Dorothy mentioned. But a lot of us are not just providing snacks in the kitchen. You know, we're catering meals. You know, we're catering meals for team meetings and off-sites, and you know, we're doing happy hours and you know other kinds of things for our employees as part of celebrations and all kinds of really cool stuff along those lines. The challenge, though, often is, you know, you go for those more convenience foods and you go for, you know, things that are sauteed or fried or, you know, pizzas, because, you know, that certainly is something that people like, but you go for double crust and things along those lines. It's not really the right direction to go if you're trying to provide, you know, healthy foods to your employees. So, I mean, we've all heard this stuff before, but, you know, avoid the Alfredos and the Au Gratins and the Bernaises and the Beurre Blancs and, you know, all the butters and all the cream sauces and things along those lines. It's generally not good. We've all heard about, you know, fried foods and sauteed foods and things along those lines, breaded and, you know, crispy fried and all of that kind of stuff. But generally, that's bad. So look, when you're looking to do meals for your organization, look for a caterer or an operator for your corporate cafe, you know, that is able to provide you with healthy alternatives to all the things that show up on this list, right? So more fruits, more vegetables, look for their sources of supply, you know, look, you know, all the things that we're trying to do in our personal lives. And this is I think the point I was trying to make earlier. A lot of times that gets abandoned when you walk into the office, right? Not because you personally, as a person or an employee, are abandoning that. It's because your employer is not really supporting that with the kinds of options that are on site. So as a human resources professional, as a benefits professional, as an office manager, as a facilities person, if you're running a corporate cafeteria or catering operation, make sure that you're doing the right things by your employees, by having healthier options. And if you are choosing vendors for things like catering or cafe management, choose vendors that have a bias towards healthy and a bias towards wellness in the kinds of programs that they provide you, right? So you don't want that industrial food service, lowest common denominator kind of food service for your employees. You really want something that has that wellness bias, and look for that in the vendors that you're choosing.
Thank you, Matt. Can you or Dorothy share some insight on what else we can do to get new employees to embrace these programs?
Yeah, that's a great question. We get that question a lot. You know, I think if you position healthy foods and snack as a benefit, it shifts the conversation. And, you know, it's one thing to say, well, you need to eat better and don't eat this and eat more of that. But it's hard to follow that program if you aren't offered those healthy choices and options at work. So, you know, the first thing is just make it available. And what's also interesting too is you need to personalize it. You know, people have different food allergies, food sensitivities. Some foods are easier for them to digest versus others. So there's not a one size fits all. You've got to really think about personalizing the food options. And people are, you know, have different drivers and different needs. I was talking about, you know, I love the hard-boiled eggs because it helps me stay on my keto diet and shed a few pounds. And my colleague loves them because he's trying to bulk up. So, you know, two very different needs. And in that case, we are enjoying that, you know, that one same snack, but in different times, we enjoy very different things. So a lot of a lot of options to help employees personalize according to their own needs. And lastly, we really believe that you have to nudge, don't push. You get much better of people just trying new foods and adopting a healthier lifestyle if you offer it as a choice versus telling them what to do. And we really are thoughtful about that, in just how we merchandise it. There's a fancy word in business that we call choice architecture. And what that translates to is, we put the healthy snacks at eye level, and the more indulgent ones, because we do offer still, a range, but the more indulgent ones, a little bit harder out of reach. So, you may have the fresh produce or the dairy or the healthier for you nuts and things closer at eye level. And if somebody wants to have that peanut butter cup, of course, the one that we have in our offering is Justin's peanut butter cup, and it's going to have, it's the cleanest version of a peanut butter cup. And if you really want to have that indulgent snack, you can definitely have it, but it's going to be a little bit harder out of reach. And those few seconds in making that decision does nudge people into better behavior. And we actually did an insight study at work where we looked at two of our biggest markets, our earliest and largest markets, the Bay Area and New York. And we looked over 23 months of data to see if people were starting to eat, on average, healthier foods. And we saw that over the course of close to 2 years, we saw that people were opting for healthier foods over that course of time. And that nudge, don't push approach really, really helps, especially if you're introducing a program that's, may feel like a stark contrast. You want to ease into it and be encouraging. And again, offer a lot of different options.
Thanks, Dorothy. You shared a lot of great insights on nutrition, what we put into our bodies. What about physical activity? Can you or Matt maybe share some insights on how we can combine that with nutrition?
Yeah, I'll take that one. But, I talked earlier about the impact of physical fitness versus nutrition. Clearly, nutrition is the foundation that you want to build on. And I don't want to minimize the importance of physical activity. And I'll use that word activity, not, physical exercise, because I think a lot of people look at, hey, exercise is daunting. It's hard. I don't want to do that. Whereas activity is something that you can do very readily and very easily. And it can be just some few simple things, right? So standing, not sitting, having a standing desk as an example, versus sitting all day long, doing walking meetings instead of, sit down meetings. Dorothy and I, when we do our one-on-ones are doing those now as walking meetings, as opposed to, sitting in a conference room. So, we can take our notes with us on our phones and that kind of stuff and have meaningful conversations and get exercise at the same time. And it's a lot of fun. Use the stairs, right? Don't take the escalator. Don't take the elevator, that kind of stuff. Just get up and move between meetings, right? Take a 5-minute lap around the building in between meetings, and all of a sudden you've spent 40 minutes or almost an hour exercising just by walking 5 minutes between meetings every day or once every hour. One of the other things that we've seen, and Dorothy mentioned Felicia Stoller, one of our advisors. One of the things that she studied as part of her research was the impact of signage in improving people's behavior. And, in the same way that, we place the snacks at a place where you can see them, if you placed a sign outside your elevator that said, hey, don't take the elevator, take the stairs today, it's amazing how readily people will follow that advice when it's accessible and prominent. So I think there's lots of simple things you can do, not only to bring the nutritional aspects in, but then also complement that with things that encourage the physical activity as well.
Thank you, Matt. So we've got a couple questions And before we get to the Q&A, let's close with a final thought on the numbers that you shared earlier. In short, we think the impact of health and wellness program is the foundation in nutrition. Can you share more on the significant impact that those CDC models suggest?
Yeah, I'll take that, Hung. You asked a question about ROI earlier, and I said that there are numbers for the CDC, and it does depend on the starting point of the company, and it's going to vary. But I think these stats are really still quite profound, and there's something to be taken away with each of them. The first one, that employees who eat healthy on the job site are linked to a 25% increase in productivity. These again are sourced from CDC, and they could still be very conservative. I spoke anecdotally about my experience of when I eat, after having joined Oh My Green and the ability to eat so well, I feel it myself of being able to end the day strong, energized, and not only energized for the work day, but you take that home and you're not only more productive at work, but you're that much more refreshed to be at home and be present with the people that you share your home with. But 25% increase in productivity, that's quite significant. I'll take that any day. Matt mentioned absenteeism. That's a good way, and I think that's a great way to measure the before and after, just a quick number. What the CDC estimates is that it's 27% lower for people who eat healthier on the job, who eat healthy on the job site. So again, it helps with you're healthier, so you can go to work, and especially if your workplace can be a destination for healthy living, it can be an appeal, and it can be a driver to actually go into the office. I know that when I work from home versus when I work in the office, I actually have a healthier day in the office because of what the foods that are provided to me, and I really love going into the office because of that. And lastly, here's a metric that speaks directly to ROI, and we talked about the savings that you might be able to have, the direct cost. If you put $1 invested in corporate wellness, it's an estimate of close to $6, $5.81 ROI through reduced sick days, higher productivity, and decreased healthcare costs. So that's, again, an industry number. It can vary depending on the company, but I think these are really great metrics. This recent CDC study is a start that helps us quantify the opportunity in embracing wellness in the workplace. So I'll leave it at that. I think there's a lot to be gained, a lot to be saved when you invest in wellness. And I guess we can turn it over to Q&A.
Thank you, Dorothy. So we have a couple questions, and I'll go ahead and ask them. First question, how does Oh My Green work with current diets, research, for example, bullet coffee, keto, juice diets?
Can you say that again? Can you repeat that question?
Sure. How does Oh My Green work with current diets and or research? So for example, bullet coffee, keto, or juice diets, how does Oh My Green work with people who are on diets like those?
Oh, okay. Well, we offer a great deal of variety, and we listen to the client services team, the client experience team, and our happiness manager, which is basically your account manager, works very, very closely with the office manager, whoever's in charge of the food and the wellness program, to get a sense of what the budget is and what is most interesting. So if you have, let's say, there are a lot of people in the office who really love juicing. That is something that we could work with as far as bringing either juices and smoothies into the office, or providing the fruit and they can make it themselves in the office. One of my favorite new products that we're carrying is juice from the rejected fruit. They call it the ugly fruit. The apple that has a dent and it doesn't look absolutely perfect is used for juicing, and it comes in a carton that you can just put right in the fridge and enjoy that, these delicious juices that are organic, non-GMO, really, really delicious. So there are a few ways that we can offer, either with a specific food that's a product that's already made, or we can give you the ingredients in order to make that. One of the things that we love doing is suggesting recipes for snack hacks. It's actually a hashtag that we use. And some of the favorite snack hacks will be, we deliver different kinds of breads and cheeses and hard-boiled eggs and avocados and different spices and sauces. And so people go nuts with like the fanciest avocado toast that they can make. And we give recipes regularly. And so those are the kinds of ways that we can deliver either the ingredients so that people can get creative in the workplace, or deliver ready-made foods to enjoy or to drink. And so to customize that based on diets. And we always listen to the client and what they need, and we have an offering that can suit them.
Thanks, Dorothy. So it looks like we have time for one more question. How else can we monitor for presenteeism outside of providing healthy and nutritious food choices?
Yeah, and I read that question earlier, Hung, and I think that, maybe it's not how you monitor, but how do you impact? And I think the physical fitness stuff that we talked about makes a big difference. I think stress management is also a significant contributor to things like presenteeism and absenteeism, right? I mean, one of the things we find, and the research shows, is that on the list of things that impact employee wellness, stress is right up there, right? Nutrition, stress, physical fitness, and providing other things. And, this could be, things like meditation classes, or things that help people deal with work-life stresses, financial planning, and, things along those lines that certainly are stress creators for people. If you can help educate and give people tools that alleviate those stresses, like I said, meditation one, other sort of, courses in education that help defray some of these other issues, like doing a better job of financial planning and money management and things along those lines, those can also significantly help.
Okay, thanks, Matt. I'm going to do one more since we have a minute left. How do you compare justifying costs, employee benefits assigned to fitness and wellness opposed to diet and nutrition? So for example, in this question, this person, their company currently offers their employees $100 a month reimbursement for fitness and wellness needs. Would they lower it to $50 a month to make way for healthier snacks and meals? How do they sell that to employees, given that most of the employees prefer cash reimbursement?
That most employees appreciate cash reimbursements versus actually having the so it sounds like choice is, if I'm getting that correct, right? It sounds like choice is what the employee is asking for, so that they can choose the program that's best for them, right? So rather than giving me a membership to 24-hour fitness, can I please have the $30 a month it would cost so that I could go to my yoga class? Is that kind of the essence of that question?
Yeah, it sounds like it.
Yeah, I mean, I think, and we talked about this earlier, is that there's not a one size fits all. And that goes with food, and that goes with physical activity. And it also goes with, de-stressing programs that help with reducing stress and anxiety. I think when you get that kind of feedback, it's because what you're offering is not really on point for that person. And so looking at the various options, not everyone likes to work out at a gym. It maybe if someone is not feeling physically fit enough to even start at a gym, that is just kind of, it's it's a non-starter for them. It's not going to get them to exercise more. So perhaps looking at customizing it with support groups or individual advice. Perhaps you can look at individual counseling with nutritionists if that's a possibility to help. I don't really know the makeup of that company, that organization, but you can start to think about like, well, why are they turning this down? And I've heard that a lot about gym memberships. Like, well, I don't feel fit enough to even go inside. I'm embarrassed to go inside and to work out alongside these people. So, simply by seeing a lack of participation in, gym memberships doesn't mean that there isn't interest in that, in the employees wanting to take better care of themselves. It's just that what you're offering is not the right fit, and they want to try to customize it. So I would say, it's a lot easier to make to find programs and have some momentum when you can have support within your company. So maybe it's a different approach of, perhaps we offer yoga one day, or perhaps gym membership is another, or perhaps weight loss management. Maybe it just starts there. Really thinking through, what is the makeup of my company? You can even do a survey. Like, we're thinking about creating a wellness program, and here are some ideas that we have. And which ones would you be most interested in? Check 5 that apply, and that will give you a read of what your employees may be looking for. And then, with the budgets that you have, seeing if you could negotiate even better rates that they could get individually, and offering that through work. And I think when you offer relevant benefits to your employees that they actually enjoy, not only does it help with, the productivity because they're taking better care of themselves, but it also impacts loyalty to the company that's helping them take better care of themselves.
Thank you, Dorothy. So that's it for Q&A. I want to thank everyone again for attending today's webinar. Thank you for your questions. Just a reminder that Culture Summit is happening next month. We're excited to be partnering with Oh My Green to provide breakfast and lunch at Culture Summit. And if you haven't purchased your ticket yet, please do, as this event will sell out. And if you're interested in providing healthier food options to your organization, please visit ohmygreen.com or stop by their booth at Culture Summit next month. Dorothy, anything else you'd like to share before we wrap up for today?
No, thank you very much for the opportunity to speak with you all. And if there are any questions, feel free to follow up with us directly. Feel free to give out my email address, and we'd be happy to follow up with you all.